Hi, I'm Dr. Philip Macmillan. Thank you for joining me. And today I'm going to be asking a question. I don't even know how to position this question, but because it's a question that is actually being asked in the United States and Montana, I thought I should apply some thought to it. So you're going to be joining me in my musings about this rather than a clear answer to the question. And it has really come from an interesting bill in Montana, a House legislature bill. I've got it here, and so I'll make this full screen for you. And it was submitted on the 17th of February 2023. It's bill number 645 by a G. Kmetz. And essentially, what he is saying is that a person may not knowingly donate plasma, blood products, blood derivatives, human tissue organs that could have nanoproteins, high spike proteins from long COVID or other isolates. So, in effect, what he is saying is that the blood from those who are vaccinated could be a risk to others. And that's really what his starting point is. Now, I guess part of the question is, does his thought have any merit whatsoever? Meaning that, is there at all any risk? One of the problems has been in terms of the scientific growth over the pandemic is about what we know and what we don't know, and trying to make what we don't know seem as though it's what we know. And what then happens is that you lose trust in the public when you say what you don't know and didn't say you don't know. And so one of the things that was said was quite categorically early in the pandemic was that nanoparticles do not circulate. But they didn't know because nobody had actually checked. It was probably more of a hope than anything else. Because when the science was done, it actually does circulate. And this was a very important paper that was done at the time in Romania. I'm surprised that this wasn't done anywhere else in the world because this was such an important question. And at the time, they found the vaccine mRNA could be detected in the blood at 15 days post vaccination. And the link is in the description, so if you can look through at it. It's an important paper because it was the first one that I'd come across. I think there have been other papers that substantiate what it was saying, and it's critical for us to understand that. And I think we have to step back and say what we don't know. How long does mRNA circulate in the body? We don't fully know because we haven't actually done the full research. And even when you look at this bit from the paper, although they said it's 14 days, that's only as far as they tested. But you can see here that the levels actually remain constant during that period. So I don't know where it would tail off. Is it actually in a month, 3 months, 6 months? You can see some tailing off here. But in reality, we haven't done the full research to confirm or refute how long this can occur for. So why would this be of concern to the unvaccinated cohort? Is it unreasonable what they are thinking? Well, I had done a presentation about this some time ago on my Substack. And if you haven't joined my Substack yet, please do. And this was talking about, do mRNA vaccines circulate? And it was the same paper. This was in July 2022 that I had done this. So this is known for some time. And what was relevant was this paper here with regards to exosomes. So, in order for the lipid nanoparticles or the mRNA to circulate, it's most likely that it is circulating in the form of exosomes. And this is how cells share information. They package things together in them, and then they put it out in these lipid nanoparticles and circulate it in the body. And so the fact that it can go on for some time suggests that the vaccine goes into certain cells and then they start packaging mRNA and circulating it around the body. And that's the most likely explanation, the exosomal transfer of mRNA. The problem is we have no idea how long this goes on for. And if mRNA can circulate, can it then go into other cells, then start to replicate, and then circulate further? And this is why the question about how long it circulates for is therefore very important. So there is scientific merit to asking the question, but we risk challenging an important area of our health system that's to do with blood transfusions. And I've got here the work from Red Cross, the history of blood transfusion since 1628, all the way down to the first blood transfusion in about 1941 with injured soldiers, and then the blood bank being created. And this has been a tremendous success for medicine across the years. So we have used blood transfusions for a long time, but we have recognized that there are some blood transfusions that are at risk. And if you look through any blood bank, there are some conditions that they don't allow blood transfusions for. And in effect, what the Montana bill is saying is that for those who are vaccinated, they shouldn't be allowed to give blood transfusions. I'm not sure if the duration is only a fixed period of time, but it does have precedent. But it's unrealistic because most people are vaccinated. And so, therefore, where would you get blood from? Or would you only be transfusing blood between the unvaccinated and the vaccinated? Are there any risks even among the vaccinated for somebody? So the questions just keep on going. And interestingly, there is now an organization that was set up in Switzerland, and this is called Safe Blood Donation. And it was there specifically to identify the unvaccinated across the world to be able to give them blood. That's very complicated, and it's going to make things extremely expensive and difficult, because oftentimes when people need blood, they need it quite quickly. You don't necessarily have time to go and get blood from another country. And so it raises so many important questions that need to be addressed. But it's not that the questions shouldn't be asked. And that's an important point. I think that one of the techniques that is going to probably therefore grow in interest is where the the person who needs the blood gives the blood. So if you're going to have surgery, you give your own blood beforehand so that that can be transfused to you. Or if you have surgery and you are losing blood, that blood is collected so then it can be transfused afterwards or during the procedure. And that can be done, but it is more expensive than receiving blood from the blood bank. And so it raises some very important questions. But again, it has precedent because this is something that we face in medicine in the context of the Jehovah's Witnesses. Jehovah's Witnesses don't accept blood transfusions at all. And it therefore requires us to come up with strategies to be able to manage these patients because they refuse transfusions of whole blood at any point, and they including perioperative autologous donation, meaning that even if they donated it themselves, and primary blood component. So there is precedent in the context that the Jehovah's Witnesses, we respect that view and we work within it. You don't always agree. If somebody is very sick, if they're bleeding, and you won't give them blood to save their lives, you have to respect their choice not to receive blood. And so, similarly, we seem to be coming towards a similar situation where could someone who is unvaccinated ask the question, is this blood from someone who is vaccinated or unvaccinated? Could they therefore refuse to have that blood and only have blood from the vaccinated? These are very important questions. And is it ethical to not allow them to have that choice? And so this is what I mean. It is really raising very complex issues for which there is no easy answer for us to come up with. But it raises the question, if mRNA can circulate, our first challenge is to understand in detail how long does it circulate for, and can we identify it for people who are donating blood? That would probably go some way to reassuring some parts of the public about risks. Because if mRNA nanoparticles were to be in blood and then they were transfused, one would think scientifically that those lipid nanoparticles could then be picked up by cells in the recipient who would then make mRNA spike proteins and potentially further exosomes of lipid nanoparticles. And therefore, in theory, scientifically, it is possible that you could then transfuse lipid nanoparticles into an unvaccinated person and therefore, in a sense, make them vaccinated with regards to spike protein. But that's just theoretical. But again, we need to know the answers. It's very important at this phase of the pandemic that we're very clear and we're very honest and we don't say what we don't know. I don't know the answer to this, but I can see that the scientific question with regards to the bill seems to be reasonable. There is certainly precedent for the unvaccinated to ask for only unvaccinated blood. Whether or not that would be practical depends upon the actual location, timing, and the need for blood. And so there are many questions that are certainly evolving out of the pandemic, and certainly steps that we will have to take generally from the medical fraternity to be able to answer. I hope you found that interesting, my musings on the topic. I'm sorry that I can't give you a clear answer on it, but it is certainly one that requires more consideration and certainly an ethical perspective for all of us to review. Have a great evening.